This patient came to see me a year ago almost for endodontic treatment of tooth number 18. As you can see, old bridge on the tooth and recurrent decay on the mesial of the tooth into the pulp. Patient had signs and symptoms of irreversible pulpitis. Options were discussed with patient, and patient said that she wanted to try to save the tooth. She had already discussed everything with her dentist. Her dentist referred her to me to do the root canal. Then patient would go back to her dentist and get a new bridge. And here's the date. So we had to IV sedate this patient because she had severe gag reflex. We tried without sedation first, and as soon as I put the rubber dam on the tooth, she started to gag, so we had to remove the rubber dam and then schedule her to come back for IV sedation. And this is immediately after I did the root canal almost a year ago. So removed that recurrent decay, went through the bridge, removed the recurrent decay, and repaired that missing wall temporarily. And then, as you can see, 3 canal systems, everything went great. Put a temporary fill in the tooth, referred the patient back to her dentist for the permanent restoration. And here's the date, almost a year ago. Yeah, so 9 months ago. This was yesterday, so 9 months post-op of tooth number 18. As you can see, tooth is restored permanently. There's a temporary bridge on the tooth right now. Well, patient came to see me for tooth number 20, so let me show you tooth number 20. This is 9 months post-op of tooth number 18. As you can see, tooth is doing beautifully. Patient has no symptoms, so tooth number 18 is in very good shape. Now her problem was tooth number 20, periapical relucency here, as you can see, and there was some buccal swelling as well. So again, we had to sedate this patient due to her gag reflex, and that's what we did just now. And here is the post-op. So went through the bridge, temporary bridge, and as you can see, 1 canal system. Everything went beautifully, as you can see, and excellent. So, by the way, this patient has this much opening. Even for number 18, we could barely fit a child-size bite block in her mouth. I don't even know how I did this tooth number 18 because I was struggling with tooth number 20, and I was telling my nurses, how the heck did we do number 18 with like limited opening like this? But as you can see, somehow we did it. And tooth 9 months later is doing beautifully. And as you can see, tooth number 20, we did the root canal. Everything went great. So this is how we do it. And this is another angulation.